Now, if still something is left, then you can ask by asking a close question. Right. Now, painkillers. As I like, we come back to the painkillers. So now your patient is in pain. Doctor, I've got pain here. How will you answer that? So you started like, how can I help you? Doctor, I've got pain in my knee. Are you comfortable to talk? Good one. Would you like to say sorry for the pain? Is it a good idea to say sorry for the pain? I've got some yes, some no. Sorry? Yeah, you didn't cause the pain. Yeah, I know. That's why PLAB2 is very important, my friend. Right? We see. It doesn't mean it's not like you caused the pain or you didn't cause the pain. Why are we saying sorry? We're just empathizing with the patient. If you wanna say it, you can say. If you don't wanna say, that's absolutely okay. But when you say it with feeling. Oh, I'm really sorry to hear about it. Are you comfortable to talk? If you just say, I'm sorry, are you comfortable? Then don't say it all. So this is what I'm saying, like learned phrases won't work. You have to practice with those things. Especially male candidates, you have to practice a bit more because our tone, I know how it is. Females still better in that way, right? So saying sorry, it's entirely up to you. Because some candidates I've seen, like even the way they say, "Oh, are you comfortable to talk?" That's more than enough. When you're empathizing with the patient, your tone of voice is more than enough. But if you're saying sorry, say it with feelings, say it with heart. Otherwise, don't say it at all. And I'm not saying sorry because I gave or I didn't give him pain. Right. So that's why I say like PLAB2 is really important because if you start working directly in the hospital, we will struggle. Because daily you will see these kinds of patients, demanding patients, angry patients, and all those patients. So we should know like how we can manage them. Right. So that's why this PLAB2 actually makes sense. Because these things we don't have in most of our countries. Angry patient. How can you be angry? Isn't that's what happened? Can you shout on the patient in your country? Yes. Why not? Here, can you shout? No. Can patient shout at you? Of course. This is the difference in the thing, right? So we have to be a bit careful on this. Okay, so pain. Sorry, up to you if you want to say. If you don't want to say, it's fine. But are you comfortable to talk? So, are we comfortable to talk? So, there are two answers to this question, yes or no. If I said yes, I'm comfortable to talk, just start with your history. If I said no, I'm not comfortable, then what will be your next line? Are you comfortable to talk? Not really, doctor, it's too painful. I will give you pain relief. Are you going to give it now or not? Because see, if you give painkillers to me now, and then you will take history, and then later, obviously, you have to do the examination as well, right? And when you do the examination, right, so take brief history, then we'll give you the painkiller. That actually makes sense. So what you can do, are you comfortable to talk? Not really, doctor, it's too painful. So I'll give you painkillers. Let me assess you quickly first. Promise with the patient, I'll give you painkiller, let me assess you first. So quickly take history, examine, and then mention about the painkillers, right? But I've seen many times you promise something and you forget it. You told I'll give you painkiller, in that no painkiller. It is gonna affect your marking very badly. So be very, 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 very careful on these kind of things. Right? But sometimes you may have some exceptions as well. For example, if there's a patient sitting and pain, and putting hands here, pain, and he asks me, are you comfortable to talk? No, pain. I'll give you painkillers. Let me assess you first. Pain. Now what? First of all, what do you think? What's the differential here? Meningitis, okay. Suspicion, maybe. Because what I was doing, first of all, I was holding this part of my head, occipital area. SH, you will see in occipital area, number one. Number two, did you notice patient was looking down and eye closed? Why? I don't like the light. Patient is shy to light, right? So they're giving you lots of non-verbal cue. Now you tell me later on when you're doing the examination, are you gonna palpate my head? I don't think so. So sometime you may be able to give painkillers in the beginning as well. Rarest of rarest thing. Not like every time. Every time you're gonna start with, are you comfortable to talk? And most probably the answer is yes, doctor. Just move on. Or else you will promise with them, I'll give you painkillers. Let me assess you first. But if you have to give, you can. Now, how are you gonna give the painkillers to the patient? Now, don't pretend to do things in the exam. In the mocks, what happened? Here's your painkiller. Oh, what painkiller? I don't know. Is it a magician show that you're getting the painkillers like that? No, you will mention to the examiner. Examiner, I want to give painkillers to my patient after ruling out allergies and contraindications. How will be ruling out these things? Allergy, for example. So we have got the records of every single patient. If the record shows patient is allergic, so of course examiner will suggest something else. And if you don't know patient is allergic to anything, just give it and find out if patient is allergic to it or not. That's what you do, isn't it? So this is what you need to do in the exam as well. And most of the times you'll see the response from their side is gonna be assume it's given. Thank you, examiner. So John, I've given you the painkillers. It will take some time to show its effect. Meanwhile, tell me more about your pain so I can help you out in a better way. Keep doing the counseling as well, and slowly, slowly, what you will see, patient will start improving. They won't improve straight away, but after a minute, you will see they'll start giving you some findings as well. So this is what's going to happen. So just remember this way: there are some filling the blanks in the exam, and who's going to fill those blanks? The examiner. You don't fill on your own. Oh, I have given you painkiller. No, only after asking from the examiner, right? Otherwise, do not interrupt the examiner too much. They are sleeping. Let them sleep. But if you need something like this, you can definitely ask them as well.
Instead of promising that I'm going to get the painkiller, will it be right to say that I'll surely see what can I do for your pain, but let me ask you a few questions?
Yeah, that's fine. That's fine.
Is that
Yeah,
okay?
that's okay.
Maybe he has some gastritis or something and I cannot give painkiller.
But I think then it's not going to be the pain. His presenting complaint is going to be indigestion or something. That's the thing, right?
Is that okay if I say
Yeah, that's fine. You can. It's up to you. See, everybody should say different thing. Many candidates they complain that you don't have empathy in the books. Oh, I'm sorry. I can see you are concerned. We have taken that thing out from the book. There is a reason behind it. In the old version of the books, if you see, we had all those things as well. And then the candidate used to come to us. You have written sorry here, not here. Should I say or not? I was like, it's not like that. Even in the whole scenario, I won't say sorry even once, but still I can be very much empathetic, right? So that's why we have taken all the empathy. Now we want you use all your own word. Use something else, use something else, use something else. Everybody will sound a bit different, right? That's the main thing. Don't try to copy